access the billing area of Perfect Bite, click on Billing in the menu selection at the top of the main screen. Let's go through these one by one. Billing insurance forms. This is what you would use to batch print insurance forms. So the first thing you want to do, step 1, is select your criteria. First question, reprint forms even if they're already processed. This allows you to pull insurance forms, maybe you've already printed them and you want to print them again for rebilling. This is a good way to pull out anything that maybe hasn't been paid for resubmission. You can uncheck it if you want to filter out those claims and not submit duplicates. I'm going to go ahead and leave my check mark in. The next option is only select claims with insurance. Sometimes patients want you to go ahead and bill their claims for them, the not accept assignment claims. So you can check this off if you only want insurance balances, or uncheck it if you want every claim to go, including the claims that are not accepting assignment for the patient. Select your doctor using the folder to the right. I'm going to leave mine set to all. You can select a date range by date entered or visit date. Date entered is a computer date, the date you actually put it in, and visit date is the date at the top of the visit, and usually corresponds with the date of service. I'm going to choose date entered for mine. I've got a wide range in here so that I can capture a few claims. And the next step, this last part, mark claims as processed when removing them from list. What this does is it marks the claim so that this question up top is relevant. If you mark the claim as being processed and you don't want to reprint these forms, by doing that it will filter those out. If you don't want to mark claims as processed, you mark no here. In most cases you'll say yes. Or it will ask you as it's posting. I'm going to mark mine to no because I want to be able to use this example again and again. The next step is to click on Search. This will find all the claims that met the criteria that I selected. This is a list of all the claims that are going to generate. Upon reviewing this list, I can also tag some of these claims not to go. For instance, I don't want this one for Catherine Eversole to go for 3306. So I'm going to double click it to tag it, and I'm going to click on Remove Tagged, and it will remove her from the list. You can also print this claim list report if you want to review it on paper. Step 3 is to edit these claims for any errors or potential errors. I click on View List to edit, and it brings up a list of some potential problems with these claims. For instance, stating that Catherine Eversole does not have her release of information set to yes, she has it set to no. Now this may be correct, but we're giving you a warning just in case you want to go make that correction. Signature on file on Robert Pfizer is set to no. This means that the patient's going to get the payment instead of the doctor. So you may want to go correct that. So you make all of your corrections here, and then you can return to edit the claims again until this is all clear. You can also print the error report if you'd like to look it over on paper. Once you're ready to print and everything is cleared out and edits are made, click on Print Insurance Forms and it will generate your batch. I'm going to go ahead and close out of here. And when you exit, it'll allow you to empty the batch so that it's cleared out for the next time. But you may want to say no if you're going to do your edits. I'm going to say yes. Going back to billing again, this time to continuation of treatment forms. This is where I would run my batch of continuation of treatment forms for any patients that I have on payment plans. Now this is only applicable to our orthodontic practices and our enterprise users. Dental practices do not have payment plans as an option. You select a doctor, a specific insurance if you wish. You can skip claims older than. We've defaulted it to 2 years, but you can leave it as 0 or put in your selected date. Skip any insurance balance that's less than a certain dollar amount if you wish. Include claims that have not received a primary insurance payment since last printed. That's a nice option so that you can rebill if something has not been paid for yet. Skip claim if there is no monthly insurance payment amount in the payment plan. Now, in order to get continuation of treatment forms to print, in your payment plan, you need to have a monthly insurance payment amount in there. And you need to set the continuation of treatment date to 30, 60, 90 days, however you bill incrementally. You need to make sure that that is set appropriately. If you bill monthly, you set it to 30. Let's go take a look at that area. I'm going to go into a patient that has a payment plan, enter into the payment plan, and I have my continuation of treatment set to 30 days, and I have an insurance monthly payment amount of $150. So I'll cancel out of here, and now let's go back. I'm going to set my computer date ahead so that we can make it 30 days in advance. Now back to the continuation of treatment forms. So I'm not going to skip them if there's no monthly payment, but you can do that. The CDT code used for forms, this is the most common code used for continuation of treatment, so I have that selected, and a note to print in the body of my continuation of treatment form. Now I will click search to look for my claims. And you'll see it shows the number of months that it's going to print for and the amount. I can tag any that I want to remove. And then I print my continuation of treatment forms. It's that simple. Close out of here and empty the batch if you wish, or leave it as is if you want to come back later to finish this.